So I'm Jonathan Frost. I'm a gynecology cancer surgeon based at the Royal United Hospital in Bath. And our Improve UK project was looking at an intervention we called HICO, so that's Holistic Integrated Care for patients with ovarian cancer. And that is supporting their physical, psychological well-being as well as treating their cancer. In our area, we have a relatively elderly population, and what we find is those older patients are less able to tolerate some of those intensive treatments that are required in ovarian cancer. Those treatments can take their toll, and so it's really important that patients are at their absolute fittest before entering into treatment. Those patients that are able to be as fit as they can be are then more able to access treatments such as the chemotherapy and the surgery, more able to tolerate those treatments without significant side effects. We screened all our patients presenting with a diagnosis of ovarian cancer, and those that were felt to be at need were entered into a programme of support, including help with physical activity from a physiotherapist, help with things like sleep and fatigue from our occupational therapy team, if necessary help with their mood, and our clinical psychology team helped with that, as well as optimising things like their blood count, helping them stop smoking or reduce their alcohol intake. What we demonstrated through doing this project is that if you support the whole patient with ovarian cancer, then they're better able to tolerate the treatments necessary to treat the disease. So more patients are able to access or able to have the chemotherapy drugs and able to get through those chemotherapy drugs without significant side effects. And more patients are fit enough to undergo the quite significant surgery that's sometimes necessary to treat ovarian cancer. The next steps for our project locally are to embed the HICO intervention into routine practice. Thinking nationally, we want to try and spread the practice of rehabilitation within the treatment of ovarian cancer to other centres around the UK. And to do that, we are pooling the data from the 3 Improve UK rehabilitation projects to demonstrate that there is a benefit from these interventions.